Can you and should you keep your gallstones after gallbladder surgery? Let's talk about it. Seems like sort of an odd question, but at least 1 in 20 people ask me if they can keep their gallstones after their gallbladder is removed. On one end, it's your tissue. You should be able to keep it if you want. It's your stuff. But on the other end, there's 2 reasons why hospitals may not want you to have them. 1, we do send everything we take out to pathology, meaning make sure there's not a cancer. Extremely unlikely for that to be the situation if we're not worried about it based on pre-op imaging. But still, if we give you your gallstones and somehow that misses a cancer, that reflects poorly on the hospital, and it's obviously bad for you. The second, more pressing issue from like a biochemical waste perspective is like, what if we give your aunt who's waiting for you in the waiting room the little jar of your gallstones, and they say forget it on the table? The next person to sit down like puts their food next to it, sees what it is, gets freaked out, reports you to biochemical board, whatever. Or if like you're walking out of the hospital with them, you trip and fall and the gallstones fall out all over the place and people are stepping on them and there's bile all over the place, and it's a disgusting mess that should not happen in the hospital or anywhere. What are people doing with them anyway? I think most people just go home and look at it for 2 weeks on their kitchen counter and then throw it away. But some people make jewelry out of them. You see this gallstone at the end of a necklace. These are gallstones that were artistically made into this pearl oyster necklace vibe. And for some reason, the market for this seems to be better in like India, but this is a necklace made entirely out of gallstones. So at the end of the day, if you really want your gallstones after surgery, it's up to your surgeon and the hospital that employs them. So you just gotta ask.